Hello, I'm Dr. Robert Gross, CEO and founder of Right Time Medical Care. This is your apple per day. Our subject is orthopedic trauma and those naggy old aches and pains. At Right Time Medical Care, we see many patients who come with injuries. And the question is, what has happened to me? Frequently we'll see a bruise, we'll see a sprain, we'll see a dislocation, or we can see a fracture of a bone. By looking at an injury, whether it's bruised or distorted, you cannot tell whether it's sprained or fractured. There are many sources for these injuries. Depending on your age, as we get older, you can slip and fall, trip on a step, twist your ankle or a dance floor. When you're young, many times children learning to walk will fall with their outstretched hand. They'll develop a nursemaid's elbow by being carried around by their wrist and dropping their weight. The elbow becomes dislocated. And many times in sports, children will sustain injuries. Football, lacrosse, soccer, broken legs, separated shoulders, fractured clavicles, injured elbows, and fractured wrists all occur from roughhousing around the house and or sports injuries with unintended consequence. So what's the difference between a sprain, bruise, or fracture, dislocation? A bruise is what it says, a big blue lump or swelling under the skin. A bruise comes when you hit somebody or you fall against hard concrete step or wall. What's a sprain? A sprain is when those fragile little ligaments and muscles get teased past their normal point of function, like cables on a bridge, made up of many, many millions of little fibers. Some of those get stretched too far and break. That's a sprain. What's a dislocation? Well, it doesn't take much to figure that out. It's when your joint doesn't work just right? It keeps popping out of the socket like that. Well, you can have any joint in your body pop out of the socket. You can have it happen in your elbow. We see that a lot with children where they dislocate the elbow. Other types of injuries are fractures. A fracture is a broken bone. You can have a minimum broken bone where it's just cracked, green stick fracture. You can have a dislocated fracture, or you can actually have a fracture that goes out through the skin. Clearly, that's much more severe than a simple green stick, non-displaced fracture. We're often asked, when do I need to come and see you? Well, if you have an injury which is associated with a severe amount of pain or a loss of function, a finger that can't move, an elbow that can't flex, a leg that cannot bear weight, or a failure to improve with home remedies, you need to come to an urgent care center to have evaluation to make sure there's no severe underlying injury. When you come to a Right Time Medical Care Center, what can you expect if you have a bruise or broken bone? First of all, we can evaluate the type of injury. If the injury is found to be very severe, dislocated bone or a fracture perforating through the skin, obviously that type of injury will have to be taken care of in a medical center. Most injuries that come to a Right Time Medical Care Center are minor sprains and fractures. For a minor sprain or bruise, we'll put you in a nice splint, give you pain medicine, recommend what you can do to rehabilitate the joint, see your private physician for follow-up. If there's a fracture of the bone, if it's a minor fracture, we can splint that. Frequently see that in the fingers and the feet. If it's a major fracture of your elbow, of your wrist, or of your leg, eventually you'll need to see an orthopedist. This has been Dr. Graw with your Apple Per Day. Stay healthy.